My dear friends, today I will be discussing what are the various diseases or clinical condition that may develop because of high cholesterol level in blood or hypercholesterolemia. So what is hypercholesterolemia? Hypercholesterolemia means increase of cholesterol in blood or increase of blood cholesterol level. Now what is cholesterol? Cholesterol is a organic molecule which is produced by liver and which plays important role in cell membrane formation, synthesis of vitamin D, synthesis of bile acid, bile salt, and helps in formation of steroid hormones like glucocorticoid, mineralocorticoid, sex steroids, estrogen, progesterone, testosterone, and so on. So it has so many functions and it is necessary by our body up to a normal limit. But when liver produce more amount of cholesterol, its level in blood will goes on rising and leading to a situation known as hypercholesterolemia, and which can be treated with antihypertensive, anti-hypolipidemic drugs, and at the same time we can treat it naturally also by doing dietary management or doing regular exercise and so on. So control of high cholesterol level is very much important to prevent various diseases, because hypercholesterolemia increase the risk of many diseases. So we'll try to focus what the disease that may leads to hypercholesterolemia, means what the disease which may cause because of hypercholesterolemia. Now we already know that many diseases may lead to hypercholesterolemia. That is smoking also. It may be because of diabetes, it may be because of excessive alcoholism, then nephrotic syndrome, Cushing syndrome. So these are various conditions which may lead to hypercholesterolemia. But today we will try to know what are the diseases which may be caused by hypercholesterolemia or increased cholesterol level in blood, and if it persists for a long time. So number one disease is coronary heart disease. Now coronary heart disease means because of deposition of cholesterol in the lumen of the arteries, it causes narrowing of the vasculature of the coronary arteries, leading to situation known as coronary atherosclerosis, which stimulates plaque formation and prevents the blood flow to the coronary circulation, and thus the muscles of the heart suffers from ischemia, leading to a situation known as angina, and it is further exaggerated or aggravated by thrombus formation or clot formation, and which may increase the risk of myocardial infarction or simply known as heart attack. So what I mean to say is that high level of cholesterol in the blood stimulates deposition of cholesterol in the periphery, and more specifically, if high cholesterol is associated with high LDL level, then LDL is responsible for transfer of cholesterol from the liver to the peripheral arteries and help in deposition of cholesterol to the peripheral arteries, maybe coronary circulation or systemic circulation or peripheral artery or anywhere. If it deposits, and it may lead to narrowing of the arteries. So in case of heart, it also lead to the deposition of cholesterol, leading to narrowing of the coronary arteries, leading to a situation called coronary atherosclerosis. That is because high cholesterol level leads to the deposition of cholesterol plaques on the lumen of the coronary arteries, and that's why the coronary artery lumen become very small, so blood cannot flow through it normally, and because of that heart muscle will be getting less blood supply, and they may suffer from ischemia, and person may suffer from chest pain, and we call it angina. So what I mean to say is that hypercholesterolemia or high level of cholesterol level in blood may lead to coronary atherosclerosis, which may lead to arteriosclerosis as well as angina pain, and may also lead to heart attack or myocardial infarction. So that is one of the important complication of hypercholesterolemia. Another important disease that is caused by hypercholesterolemia is stroke. Now stroke, what is stroke? Stroke is also known as cerebrovascular accident, or in simple term we can call it, or layman's term we can call it, brain attack. It is of two types, ischemic stroke and hemorrhagic stroke. Now ischemic stroke is because of narrowing of the vessels, because of formation of thrombus in the vessels supplying the brain. So because of the blockage in the vessel supplying the brain, so it leads to the increased risk of stroke. Now hypercholesterolemia or high level of LDL in the blood may helps in deposition of LDL in the cerebral vessels also and leads to atherosclerosis there. Besides, it also responsible for clot formation in the brain. It stimulates clot formation, and beside, high level of cholesterol in the blood may be injured with free radical induced damage, and because of that toxic oxidized products may also form, which may cause endothelial injury and helps in the formation of thrombus as well as formation of or deposition of cholesterol plaques in the lumen of the artery supplying the brain, and increase the risk of ischemic stroke. Besides, increased cholesterol deposition in the lumen of the arteries also increase the chance of hypertension in long run, and that's why it leads to hypertension. And chronic hypertension, and if it is not treated, may act as accelerating factor or one of the important risk factor for causing stroke. Thus, high cholesterol level directly or indirectly increase the risk of getting stroke, also known as cerebrovascular accident or simply brain attack. Now comes another disease which is also caused by hypercholesterolemia. So that is called peripheral artery disease. What is peripheral artery disease or peripheral vascular disease? In peripheral vascular disease, because of high level of cholesterol in the blood, cholesterol will deposit in the arteries of the peripheral extremity supplying the limbs. And because of that, there is atherosclerosis of the peripheral arteries, which is nothing but decrease in the lumen size of the blood vessels, especially arteries of the peripheral limbs supplying the peripheral limbs, and that's why blood flow to the muscles is not proper enough to maintain its metabolism, and that's why muscle will suffer from ischemia and they become very weak. So person cannot walk for a long time, then they have to take rest, and otherwise they will suffer very pain in their muscles or tiredness. So this is one of the important clinical features of peripheral vascular disease or peripheral artery disease, and high cholesterol level may be because of that. So high cholesterol level may increase the risk of peripheral artery disease. Next one is diabetes mellitus, especially type 2 diabetes mellitus. Diabetes mellitus is of two types, type 1 and type 2. Type 1 is because of insulin deficiency and type 2 is because of insulin resistance. Now, how cholesterol is associated with type 2 diabetes mellitus? Now actually type 2 diabetes mellitus or type 1 is associated with ketoacidosis or production of excessive ketone body. That is because in diabetes there is lack of insulin, or because of insulin resistance, insulin deficiency or insulin resistance, that insulin cannot work properly, either because it is not there or because the receptor is resistant to insulin. Because of that, insulin cannot work properly to cause uptake of glucose in various parts of the body, and because of that glucose uptake is reduced and the person suffers from energy lack. Now somehow the body has to metabolize to get energy, that's why fat starts breaking down, and it leads to the increased beta oxidation of fatty acid, leading to the more production of ketone body. Now excessive production of ketone body in the blood will shift the ketone bodies towards the cholesterol synthesis, because ketone bodies, especially acetoacetic acid or acetic acid, is important precursor of cholesterol synthesis. Thus, because of type 2 diabetes mellitus, the ketone body, especially acetic acid, will shift towards cholesterol formation and increase the cholesterol level in blood. So type 2 diabetes mellitus is associated with hypercholesterolemia, and it may lead to hypercholesterolemic changes. Because of hypercholesterolemia may also be there, leading to various complications like atherosclerosis, arteriosclerosis, coronary atherosclerosis, and increase the various vascular disease also. In diabetes also, vascular disease is also very common, because diabetes patient can have hypercholesterolemia, and in diabetes patient hypercholesterolemia may increase the risk of suffering from stroke, hypertension, then heart problems like coronary artery disease, myocardial infarction, coronary atherosclerosis, and so on. So these are the mechanism or how diabetes is associated with hypercholesterolemia. Next disease is rise of BP or hypertension. Now according to some literature, even hypercholesterolemia or increase of and cholesterol level in the blood for longer time causes coronary atherosclerosis or vascular atherosclerosis or deposition of cholesterol in the peripheral arteries. And because of that, there is coronary atherosclerosis, which may lead to hardening of arteries called arteriosclerosis. Both these mechanism, it may be harmful because both in coronary atherosclerosis there is a decreased flow to the particular organ, and because of that peripheral resistance will increase. Because lumen size increase means peripheral resistance will increase, and that's why blood pressure will increase. That's why hypercholesteremia for a longer time may increase the blood pressure level, and this hypertension for long run can increase the risk of suffering from various heart complication and even life-threatening myocardial infarction and even stroke. So these are the various diseases that may be caused by hypercholesterolemia. So we should not take cholesterol level very lightly. We should diagnose the hyperlipidemia or hypercholesterolemia as soon as possible, and we should try with dietary interventions as well as a regular exercise and stoppage of smoking, alcoholism, control diabetes. At the same time, make proper dietary changes, avoid excessive trans fat, avoid refined carbohydrate, avoid simple sugar, and so on. And by doing that, cholesterol level may come down by natural means. Besides regular exercise, also lower down the cholesterol level and helps in treatment of cholesterol level. Besides, in case both the therapy fail, natural treatment fails, then there is medication therapy or chemopreventive therapy or chemotherapy, that is hypolipidemic drugs or anti-cholesterol drugs, that is statins, then fibrates. These are there which decrease the triglyceride level, decrease the cholesterol level, and thus they plays an important role in management of hypercholesterolemia. Thank you very much.